Hello, my name is Isabella Chu, and I'm the Associate Director of the Data Core at the Stanford Center for Population Health Sciences. And today I'm going to talk to you about the data offerings at PHS. On this table, you can see kind of a general overview of many of our data sets. I'm going to focus on sort of the strengths of each of these data, and you can kind of see basic information here in this table. So the American Family Cohort is an electronic medical record data set of about 6.6 million people. This data set can be linked by individual with permission from the data owner. And it's particularly good for studies in rural America or where you need linkages in order to complete your research question. We have a 20% Medicare sample. These data are very rich and longitudinal. They retain PHI. And they're very representative of Americans over 65. They're good both for population health studies and for econ studies. They have things like price. We have the American Hospital Utilization Data Set. This includes detailed information about insurance carriers. So the data themselves are quite de-identified with respect to the patients, but very representative of hospitalized Americans. But you can do research on health econ in these data that are very difficult to do in other data sets. Obviously, the name of the insurance carriers have to be obscured when you publish, but these are very useful for that sort of study. We have two very large commercial claims data sets. We have Optum and MarketScan, and we have multiple years of both. Optum is a little bit better for population health studies because it's got a more granular geography. It's a bit richer, and we do have some lab data. MarketScan is better for health econ because there's a large number of insurers in the data set, and they do have prices. In both cases, they're very good for population health. We have historic census data with individual information through 1940. So if you're studying older Americans, this is a very good data set if you want sort of historic data on where they lived and things like that. And then I wanted to highlight two international data sets we have. Born in Bradford, which is a birth cohort of about 13,000 parent-child pairs from a city in northern England. It's about 40% South Asian descent. And they have very rich longitudinal data. They have things like education, surveys, socioeconomic data, and biologic samples. The Aarhus Danish registers are very similar, except for the entire population of Denmark, minus about 5%, is in this data set. Born in Bradford is much easier to access. You simply have to complete a number of sort of security steps, whereas with Aarhus, unless you're in the EU and have an affiliation with a Danish institution, you cannot directly access the data. However, if your project's approved, they have analysts that can complete the project for you. To access our data, you go to our portal at phsdata.stanford.edu, and once you've completed all requirements, we have two computational environments, which are both managed by SRCC. You can either work in Nero, which SRCC will give an introduction to, or a small cluster of our PHS Windows servers. Both of these environments have been approved for high-risk data. So here's more detailed instructions on how to do that. If you want to explore them yourself, go to phsdata.stanford.edu, search and select the data set you want, click apply for access, and then you just, on each of the steps, it gives you detailed instructions at the top. If you have any questions at all, we have detailed instructions also at phsdocs.stanford.edu. Here's more information on how to contact us and how to find instructions to get access to our data sets. And I look forward to seeing you on April 22nd.